to individuals in either athletics or allied health fields is oftentimes a little bit different than maybe some of the backgrounds that you've had. When I was an undergraduate, my interest was in psychology. I was interested in behavior. I wanted to be a clinical psychologist until I actually did like some internships working with people with mental health issues, and I realized right away, like, that's not going to happen. These people are crazy. They take up a ton of effort, and it just was a struggle for me. And so instead, one of the things I was really interested in, or what really turned me off from like clinical psychology, was a focus on getting people to function normally. So they have deficits. They wanted to give them some techniques so that they could then, function normally in life. And to me, that was somewhat a negative because I'm more interested in how do you get those individuals to function like optimally, to be really successful. And it's that side of the spectrum that really became an interest to me. Kind of led to where I am now, is trying to understand what do people who are excellent at what they do, what are some of the mental characteristics they incorporate, how do they handle things like adversity, and I really wanted to study that. I wanted to study mental excellence, and since that time I went to Cal State Fullerton for a couple of years, or so, you as well know, been there, where I got my master's in sports psychology, and then since then I went to the University of Tennessee, where I continued my study and obviously ended up here in FSU. So my interest in some of the things I'll talk about tend to be from a psychological standpoint, in particularly looking at mental skills and how it affects movement. Our control of movements, learning, and then also trying to enhance already well-rehearsed skills that we have. So I'm going to talk about imagery, and I know I have several students that have taken my class here, so they probably will be familiar with some of this stuff. But I always start out with just a little bit of outline, kind of preview what are some of the things that I want to kind of get across tonight and talk to you guys about, and trying to make sure that it is relevant to most of your disciplines. I know many of you are athletic trainers, and so I try to incorporate some research that would be applicable to the fields you're interested in. So I'll define imagery. I think most of us probably have an idea of what imagery is. And usually when I talk to this, either with athletes or coaches or individuals, not even in sport, they have this kind of picture in their head of like, okay, this is what this is. It's kind of like daydreaming at times, where it's just these kind of mental pictures that come in and out of our head, and it's kind of applying to sport. Yes, there's obviously aspects of that, but I'll talk about a very systematic way of applying this particular skill, and potentially how you all in your disciplines might be able to use this. I'll spend a little bit of time on imagery research. And I always do this because I always challenge my students, if they're going to be doing something, they should have a rationale for why they're doing it. So I'm going to make kind of an argument tonight that this might be a skill that you can incorporate in some of the work that you do. In order to make that argument, I want to give you some background, some research that justifies that argument. So I'll spend some time talking about some of the research. I'm not going to go too in depth in all the statistics, but generally I'll give you an idea of what the research was on and what are some of the basic findings, some of the take-home messages that might apply to you all. I'll talk about theory in terms of this will kind of give us a little bit of an idea of how imagery actually works. I think people have an idea that it exists, but what's actually going on in our mind and how does it affect our ability to produce movements or helps us learn various skills. I'm just going to briefly touch on that because it's important for me to set up best practice, which is kind of my take-home messages in terms of if we're interested in exploring this a little bit further, using some of the athletes that we work with, what are some things that we'd want to consider? All right, so defining imagery, I use this definition here. So if you're kind of looking at this screen, this idea of recreating or creating a polysensory experience in the mind's eye, polysensory just means multiple senses. And you think about touch, hearing, sight, all those things that we want to incorporate in this particular image. So it's very simple. You don't even have to close your eyes to kind of start utilizing this skill. If I just ask you to think about, let's say, a family member, someone you're close to, most likely images, aspects of that person, or emotions towards that person kind of pop up into your head. If I ask you to think about your kitchen at home, again, some of those senses, the pictures, aspects of what's in that particular kitchen or that room are going to probably start popping up into your head. Now, that is definitely imagery, but it's not very structured. And it doesn't necessarily going to be helpful for us to either acquire a skill or be purposeful in using that for a specific reason. So this is part of our definition in terms of recreating or creating. But what I would argue is that in order for us to really get something out of this, we have to be purposeful. We have to be systematic in how we go about implementing this for a particular reason, rather than just, I think oftentimes what happens is athletes might think of a particular performance. It's like, oh, I had a good performance this time, I kind of replay that a little bit. But there's really no particular purpose in doing so, in doing that. All right, here's a little video I wanted to show you, so hopefully we have audio. That gives us a little bit better idea. It talks a little bit about defining imagery, but also talks about some of the what's going on in terms of our mind, the neurological aspects of it. So I'm going to play this quickly. It's just a couple minutes. If you've had me in my classes before, you've seen this. So
it's a learning method called visualization. Rebecca won't have to move a muscle. Rather, she'll rehearse the entire sequence in her brain. Rebecca stands still and concentrates. She visualizes every stage of the somersault, the moment she releases the bar, the instant she twists her body, and the second she catches the bar. And she does this over and over again.
Visualization does help you when you're learning a new move. You can go through it in your brain before you actually have to do it yourself.
Scientists have discovered there's a region of the brain that's activated when we imagine a body movement. Pathways through her brain cells as if she were actually doing the somersault, all without moving a muscle. It means that when she does perform it for real, she should find it easier, because the pathways in her brain are already in place. Will it work? Rebecca has repeatedly visualized each tiny twist and turn of the somersault in her mind. But has she established strong enough pathways to make her body do it for real?
Right, nice and hot.
I think that one of the main reasons I like to show this clip is it talks about this idea of creating pathways, and these neurological pathways that are created, areas in the mind that we use for particular movements or emotions, are activated when we imagine that in a specific way. We're purposeful in doing that. Now, in order to really activate those strong enough to where it actually then will affect our performance, we need to do so, again, kind of creating that polysensory experience. We experience day-to-day life in a polysensory experience. Sight, sound, smell, all those things, again, need to be very similar. When we talk about theories, one of the probably the biggest theory recently that people use to explain imagery now and why it's effective is this functional equivalence theory. When we produce movements and we memorize movements, which is effectively how we control movement and learn stuff, we're doing the same thing if we're kind of effective and we develop this skill in terms of imagery practice. So the idea that these the imagery and physical practice are somewhat functionally equivalent. Now obviously that's not exactly the case. Physical practice is always going to be a little bit superior, but we can get some benefits by just sitting down, thinking through whether it's a movement trying to reacquire something or a situation that'll allow us to make better decisions when we're actually experiencing that particular activity or if it's sport, that particular competition. All right, so I'm going to talk about imagery research, and I have 4 studies that I want to talk about that kind of illustrate, I think, provide some basic evidence that this is a skill when taught and utilized can either increase learning, skill acquisition, speed it up, or when we're talking about like recovery, speed up our recovery times. All right, so this idea of this question, when I first started in this field, I was just fascinated by this. I think some people kind of think it's funny, but by this idea of just reading these reports from professional athletes about, oh, I'd sit down and I use this visualization or imagery, and it has all these benefits. And it just kind of surprised me, like, that doesn't make sense. Like, we can just sit there, think about something, and it helps us. Like, we're not doing anything. And it's such a low cost on our end. It doesn't require a lot of effort to just kind of think through this stuff. And so this has been a question that I've explored since my days at Phillip. Like, does this really work? I was skeptical at first. And I think most people, and even when I introduce this to athletes now, I think they're still a little skeptical. They'll do it, but they may not be really adhering to making sure they're getting the maximum benefits from it. So I'm going to give you some evidence that I think suggests that it does work. And now there's thousands of studies out there on imagery in a lot of different fields, so obviously we can't cover all those. But I'm going to cover 4 of them that I think are pretty pertinent to things that you might be interested in, and it also gives us a little bit of background on this research. So this 1991 study was kind of a landmark study because it was one of these first studies that started looking at imagery and its effects on different types of motor tasks. Right? So we can classify motor tasks in a variety of different ways, but one that's really kind of important is this idea of kind of a continuous types of task where we do like a simple motor task. When we think about motor tasks, think about like skill execution is important. Like being able to do like a clean and jerk, that's a motor task. It's all about kind of, can I produce the action? Versus more cognitive tasks where decision making is important, where I have to make the right decision. So this was kind of the first study that started separating out and said, well, is it possible that imagery has differing effects on different types of tasks? And we'll talk about what these tasks are in a second. But it's also an important study for me because in terms of the groups that they utilize. So you'll notice on the right-hand side of the screen here, you have different variations of what I'll put as physical practice. So they just trained physically. And then they had some combinations of that physical practice and imagery practice where the participants spent part of the time mentally practicing or trying to learn one of the 2 tasks here, the motor or cognitive task. All right, so design, I know most of us may not be interested in that, but for me, it's something that's important to look at how are they examining the effects of the different practice conditions, just pre-post. So they did training, and they came back and did a post-test over a 7-day period. Okay, so this is the motor task. Again, just requires us to produce the action. It might sound funny, we don't use this in motor learning anymore. This is a pursuit rotary task. You'll see that little white kind of target. It's essentially what participants had to maintain contact with that with a stylus. And it would go around about 45 RPMs, and it was just about, can I maintain contact? And they didn't require any decision making, it was just about being able to produce the skill. So here's the results of that particular, okay, they did a 7-day period, they practiced their various combinations of physical practice and imagery on this continuous task. It just requires our ability to produce this skill. So I'm going to kind of put a red box around there because to me this is important. The white square, that bottom white square, that's just mental practice only. So they're just doing imagery. In that condition, it did not necessarily improve performance beyond just the control conditions. Control people didn't do anything at all. So in this case, perhaps these motor tasks, mental practice, imagery may not necessarily be beneficial. Anything where we got a significant effect is any combination of mental practice and imagery and physical practice. So it may not necessarily be that imagery is not helpful, but it looks like at least for these types of tasks, you need to supplement a little bit with physical practice. All right, so the second part of their study looked at these cognitive tasks that require decision making. Now, in this, the results for this, it's much clearer that doing mental practice on its own helps us in terms of making decisions, learning the particular patterns. So with this cognitive task, they did a pegboard task, and essentially what they were learning were the correct sequences in which the pegs needed to be inserted. So here, doing it physically, having some combinations of physical and mental practice, enhanced performance, but then also just thinking about it, not doing anything at all, helped in terms of learning that cognitive task as well, much more greater than doing no practice. So here, at least with this types of tasks, it seems like doing mental practice can be somewhat similar to physically practicing the task. All right, a study that I recently did, I want to talk about that was a little bit more on about a motor task, so it's a little bit newer. But one of the issues with the Hurdle study was they didn't really use theory-based interventions. So something for me, like I wanted to follow up on that. Like they kind of make an argument that learning these motor tasks, imagery may not necessarily be effective, and I'm not quite sure if that was actually the case. So we did a study recently that obviously just got published last year. We had 76 participants. It was to students here at NMSU, and we had a complex motor task. So here, the task that we ended up using was a standing long jump. Could they, particularly just mentally practicing over a 4-week period, learn and improve upon their standing long jump performance, this complex task? So kind of similar, but not as many groups here. We had a 100% physical practice group that came into the lab. All they did was just do physical practice and standing long jump. We had an imagery condition. All they did, they came in, they mentally practiced this complex jump. They didn't do any jumping at all. They just kind of experienced themselves getting further and further, reaching a particular distance, a half and half group, and a control group. The control group just comes in, they read a magazine, they don't do anything. Kind of gives us a baseline. Pre-post, 4-week intervention, and again, we just had them do the standing long jump, and we measured their maximum jump. They did 5 jumps in the pre-test, 5 on the post, and we just took whatever their longest distance was. All right, so the results, kind of interesting here. So another kind of red bracket around the top here. So the red and light blue is physical practice and physical practice plus kind of imagery. And in both of those cases, what you see here is that those significantly improved, and they were superior compared to just the imagery group and the control group. The interesting thing for me, though, was I expected that. I didn't expect that the visualization or the imagery group would kind of maintain their performance. So they're not doing anything physical here. They do a pre-test. They come back 4 weeks later. I kind of anticipated that, based on prior research, they probably would leave off. They probably either drop a little bit in performance or not really experience any benefits. But they actually improved slightly. And they kind of maintain their performance. And if you compare that to the control condition, people not doing anything, their kind of performance impresses. They actually get worse. They're losing distance on the standing long jump. So it suggests to me with the motor task that perhaps may not necessarily help us learn it, but it might help us in terms of maintaining the initial blueprint of that particular task. So when I try to do it again, I've already rehearsed it several times. It makes it easier for me, at least to start off where I left off, even if that was 4 weeks ago. So I have this kind of gives you the change from pre to post. So you can see those training groups that involve physical practice and imagery. They had pretty significant changes to their jumping distance. But that imagery group, you can see they improved slightly by 2.21 centimeters. They kind of maintain where they left off or where they started at, versus the control group gets worse. And if you just did, I kind of analyzed like from pre to post, was there any type of improvement or any significant decrease? What we find is that that control group, from their pre-test score to their kind of post-test score, there's a big drop off there. So again, it kind of reiterates to me that doing this mental practice, doing kind of at least that, is better than doing nothing at all. So if we're trying to relearn or acquire a task, at least having them do this, if they can't physically practice, should at least help them maintain kind of their initial performance levels, or at least where they left off. All right, a couple other studies. These ones a little more clinical. So this Page et al. Study was looking at stroke patients and stroke rehab, and adding imagery as an adjunct to traditional physical therapy. So just a little bit about the participants. These are more clinical trials. So oftentimes finding stroke patients is a little bit difficult. It was a pilot study, so we only had 11. Obviously, the age is a little bit older than most of the earlier studies. They had a stroke. They were released within that 1 year period post-stroke. And they had either a non-use of their arm or that arm weakness. So they had some initial criteria in terms of their entry of their kind of rehab. A couple of variables that they looked at. One was, okay, we're going to give them this intervention, we're going to give them some rehab, and we want to see, does that improve the quality of their movements of their effective living? Does that improve their usage of it? So with obviously stroke patients, a couple of things happen. The quality of the movement declines with their affected limb, and oftentimes they end up not using it. So it becomes just a liability for them. So within this particular research, they were looking at, can we improve the usage of that? Can we improve the quality of their movements with the affected limb? This other second variable is just a test, action arm research test. I put it up there. It just looks at things like gripping, grasping, very basic skills that we use with the arms. It's a particular test that's been designed for particularly looking at research with stroke patients and their ability to grab or manipulate objects. But it was another test that they utilized to kind of measure, are these people improving with the training that they're getting? So here's the groups again, pretty straightforward. They just did physical therapy. So they kind of got randomized into one of two groups where they just did their traditional therapy twice a week for about 30 minutes. Or they got assigned to a group that did the therapy, same therapy, but then afterwards they did some imagery practice. So they focused on using that limb. They kind of focused on particularly grasping, reaching, gripping types of movements to see if this supplement, this adjunct of imagery, improves their overall performance. So it was a single blind study, which basically means the people doing the assessments didn't know who was in what group. Kind of allows us to reduce any type of experimental bias in those types of situations. So I'll give you a little bit of details. The PT was 30 minutes for 2 times a week. Imagery session was 30 minutes on top of their regular rehab, and it was over a 6-week period. All right, so again, kind of focusing on that affected arm, the non-use or weakness, and here are their results. So again, I'm gonna go back there. Look at a couple things here. This is just from their particular paper, Page's paper. The AOU is just kind of the observed use of that particular arm. And one of the things I want to point out here is they had caregivers kind of look at like how much are they using it. They had the patient report, like how much am I using it now after kind of the intervention that I was assigned to. And you'll notice versus the control versus the MP group that had kind of the adjunct of that imagery, there's a significant change. Now I know it's not large changes, but it's much more than just the control group, almost double their use and observed use compared to those that just got kind of the rehab alone. In terms of quality of movement, so this is again their ability to really manipulate and produce adaptive movements. Again, you almost see double what the control condition is doing. So in both cases here, it seems like this addition of mentally practicing, kind of just thinking through the variety of movements is helping restore what the authors kind of talk about, kind of those neurological pathways, making it easier for them to acquire or reacquire these skills, in addition to some of the practice and rehab that they're getting. So by just simply adding this intervention, which is very low cost, doesn't cost anything in terms of like healthcare costs, that we can kind of take advantage of, and we ask people to do it, we get this profound benefit for these individuals trying to rehab in terms of their stroke and their affected arm use. So their action research test, in terms of the numbers, it goes up on a scale from like 0 to 57. So you get an idea here. Again, I'll point out the changes, both of them improve. So by doing that rehab, they're getting better, they're getting stronger. But you can tell that the group that has the additional imagery, there's a larger change, a significant difference in terms of improving their functional use of their arm compared to just doing the traditional rehab on its own. All right, last study. That might be more applicable to your interest, looking at kind of the ACL tears. So this is ACL first time repairs, it's ACLR, in terms of that surgery. And essentially they wanted to see people that are rehabbing for 6 months, if we do a traditional type of rehab for their ACL, if we added some type of imagery or practice to it, would that then kind of speed up their recovery time? Would it improve knee strength beyond just doing traditional therapy? Would it improve the integrity of the knee? So we're looking at the various ligaments and looseness of those ligaments. And then stress. So one big thing about imagery, or at least some suggestions about imagery in the rehab process, is that it also has kind of a relaxation response. So if we can get our patient to relax, we can get them focused on these functional movements, that perhaps that combination might supersede just doing traditional kind of recovery rehab alone. So again, very similar in terms of our groups as the stroke study. We had just traditional rehab over a 6-month period, and we had one group that had the addition of kind of imagery. So they're mentally practicing particular movements, so extension, flexion of that particular movement. They also did some healing types of imagery where they kind of see that processing getting better functional use to see if those neurological pathways could strengthen their ability to produce those skills. So design, again, similar single-blind study where the people doing the assessments had no idea what group these people were assigned to, and then making a decision, is this kind of an effective skill set to their traditional rehab. The one negative of this particular article is they didn't really give a good description of what their rehab looked like. It was more of like, they did a traditional standard 6-month protocol, but there wasn't very specific about what that included. So that was somewhat of a limitation, but the results still give us a kind of an idea of, is this an effective skill to kind of combine with traditional rehab. 9 imagery sessions, which is another little bit limitation. They basically, throughout the 6-month period, would introduce them to a new aspect of imagery, whether it focused on healing, whether it focused on movement, and they added to that throughout the 6 months, and then they would give them like a CD to continue listening throughout the week. All right, they used a Cybex machine, isokinetic machine, again, kind of looking at extension flexion, particularly looking at overall knee strength, things like power, torque. And their reports, their graphs are a little more confusing, so I'm just going to generalize it in terms of their findings. So here's a big thing for me, right? Because there's always this stuff, oh, imagery's great, it works. In this study, there was no difference between the traditional rehab group and adding imagery to it. So there was no significant difference on how they looked at knee strength. But where there was a difference was integrity. And they're looking at particularly the integrity of the knee, and what they found was adding the imagery and essentially were able to kind of make a little bit tighter structure. And they had better knee integrity compared to just the control group. And then lastly, they looked at stress hormones. So they looked at dopamine, adrenaline, noradrenaline, and essentially these are often commonly associated when we get stressed. We have more of those hormones in our blood. They did an assessment kind of pre-post, and what they found was those that had the imagery and they kind of focused on the relaxation part of it, the healing part of it, generally had lower levels of those hormones in their body compared to those athletes that were in the control condition and just doing kind of their physical therapy alone. So the take-home message of this, at least what the authors talk about, was they're a little bit surprised that they didn't see any differences in strength, because 2 prior studies that were somewhat similar did show a benefit in terms of knee strength by adding the imagery compared to that control group. But they did find in terms of the integrity of the knee that was superior, and then also looking at it in terms of overall stress tended to be lower for those individuals that had this imagery added to it. So one kind of postulation with this idea is that perhaps it helps speed up that healing process. If we can kind of focus on those specific mechanisms, the healing process, being able to kind of be relaxed and cope with that might be a benefit to the overall healing process and added to the traditional kind of therapy alone. All right, so just general findings that I think would apply to most of the interests that you have. So one, what we see, if you look at an aggregate of most of the research studies that are conducted, you generally find that imagery can benefit skill acquisition in a variety of different tasks, that by adding this to skill instruction, you generally see kind of a benefit, particularly if you notice kind of like my second bullet point there, if it's added on traditional, just normal physical practice. We don't want to take away physical practice. I think sometimes when I talk to like athletes or coaches about this particular skill, it's like, you know, we have only so much practice time, and we have to really dedicate that to certain aspects to it. And I would agree, that's first and foremost, like the most important. Like physical practice is superior. It is the best at creating memories. It's the best at facilitating skill acquisition. It's the best at in terms of improving performance. But there's so much downtime throughout the day when we're not in practice, where we're just sitting there, whether if it's our athletes, they're like on their PS, whatever, 4 now and Xbox One, and they're really not doing anything to benefit either learning something or getting better or healing, and they can be spending 5 to 10 minutes literally just mentally practicing and getting better, either if it's like we're talking about in terms of rehabbing something, or if it's in terms of acquiring a skill, or if it's in terms of maximizing their performance, but they would add on to what they're doing in practice. It would be allow them to become just a little bit better by strengthening some of those neurological pathways, strengthening that memory, and will allow them to be even better if they spent a little bit of time outside of practice doing that. So kind of this combination of adding imagery to physical practice seems to be better than just physical practice alone, which is better than just doing imagery alone, which is better than doing nothing at all. Those are pretty much the traditional findings that you see in over hundreds of research that's been done on using imagery and how it affects skill acquisition. Performance on well-rehearsed skills, very similar type of scenario. Looking at like Olympic athletes, skiers, when they kind of add this to their traditional training program, they generally see spikes in performance in a variety of different measures. One of which we'll talk about kind of that bottom one, psychological states change, things like confidence changes, their ability to deal with stress changes, which has an additive effect in terms of their performance. But their overall skill production, when they look at things like gymnasts as well, Olympic gymnasts who add this to kind of their routine and their training, they tend to produce better form, their timing improves, their rhythm improves. So again, it seems to have this additive effect to just physical practice alone. Our third bullet point appears to be effective in terms of an adjunct to physical therapy. And again, our last study didn't show necessarily an increase in knee strength, but overall, with those findings and some of the clinical research that's been done with stroke patients, it seems like adding this, again, very low cost, doesn't require a lot of effort on our clients or our athletes' part, that it's going to facilitate their recovery. It's definitely not going to hurt. And that's kind of one of the questions sometimes I get is like, is this going to interfere in my ability to produce certain movements or hurt myself in any way? And the answer is no. I don't know any study that shows to be a debilitating effect. Even when they have people image negative stuff, it doesn't seem to necessarily translate to hurting their skill acquisition or anything in terms of recovery. All right, so how does imagery work? In terms of what do we think that's going on, we saw that little video that does give a nice overview of this neurological basis. We're activating various pathways, we're strengthening those pathways so those action potentials are easier to occur, to be able to create these particular movements. So that's definitely one aspect we'll talk about. The first one is something that I ascribe to, that I talk a lot about when I write my research papers, because in addition to looking at things like sports psychology and imagery, I also look at motor control and motor learning. And if you look at kind of how we control actions, how we produce movements, how we learn things, that's all about long-term memory. And so the idea is to kind of, if we can combine motor control theories and this idea of imagery, can we figure out a cognitive model to explain how this stuff works? So this bioinformational theory is in the 70s. This idea is that what we're essentially doing when we image something, we're bringing things up to working memory. Right? All of us right now are using working memory. Whatever I'm talking about, if you're paying attention to what I'm talking about, like you might be focusing on those words or those sounds, or if you're looking at something on your phone or thinking about whatever you need to do later tonight, that's what you're focused on. Your attention is in working memory. The idea is that if you use imagery, you can then take up that working memory space and focus on a particular activity, focus on a particular situation that you can manipulate in your mind's eye. So the idea here, Lang talked about that we have these stimulus propositions. So if I am a skier and I want to practice a variety of situations, what I essentially do is I want to kind of give myself some context. So these stimulus are like, what are all the stimulus, the environment, the visual stuff that I'm going to experience when I'm doing this activity? I want to bring that all into working memory. So I want to create this kind of picture in my mind's eye. And that will happen with practice So now I have the stimulus, like, okay, this is what I'm going to be doing. This is the color, kind of the environmental context in which I'm going to be in. Maybe there's some pressure associated with it, so I kind of have to re-experience like the physiological activation that I'm going to have in that particular scenario. So now I have that. I have this context. It's what I do next is really important. So Elaine talked about if we then kind of practice our response step. In long-term memory, now we can bring up this response proposition. It's basically what's our motor response to that? How do we want to physiologically handle that? So maybe I'm a little anxious at first. My heart rate's increasing. I can then practice more of a relaxation response to that. I can practice the correct movements, ideal how I want to execute those particular run if we're focusing on skiing. And so the idea is with repeated rehearsal, it gets easier for me to recall those response propositions from long-term memory. So then when I actually get to the performance context, I've already been there. Now I can recall from long-term memory this correct response. So I'm there, I've already had this store, I've kind of played with it, I've manipulated that response to now that it's well rehearsed, well defined, it's crafted, and I just recall that's working memory is what we're doing anyways when we're performing a skill. We're just recalling that particular movement to working memory. So again, this kind of overlays these theories of movement, really modifying stuff in long-term memory, and so we're modifying until we get it to an area where we really like it, and then we can kind of recall that when we get to that situation. The second, probably the more recent theory that most people are utilized to kind of explain this benefit of imagery is this functional equivalence model. So this is a lot of like fMRI studies looking at what's happening to our brain when we image something and we actually physically do something. And more of these studies are showing that essentially what's happening if we can picture ourselves either producing a movement or even if it's like experiencing emotion, those same regions in our brain get activated, whether we're doing it or whether we're just imagining it. So there's this idea that we can kind of access similar parts of our brain that control perception, motor control, emotions, and again, repeated rehearsals of that strengthen those neurological pathways, strengthen those areas in our mind, making it easier when we actually get in that situation to then produce those particular movements. So up here I have a couple of areas of the brain. There's more that are involved, but these ones are primarily involved in movement. So our prefrontal cortex, our motor cortex, premotor cortex, basal ganglia, all of those